everybody. So today on the podcast, we have Dr. Thomas O'Connor and Jodie Engel. How are you guys doing?
Great.
Doing well, doing very well. About to pull up here to work here shortly and hang out with you guys for a few.
Perfect. So, we have had Doc on the podcast before. Doc, I know you've worked with a ton of bodybuilders, and it's kind of your wheelhouse. And Jodie, you and I connected. I don't know when it was now, maybe even a couple months ago. But when you had everything just starting, and I thought it would be good for you guys to connect, maybe get different perspective, because the reality is there aren't that many doctors out there who work with bodybuilders. And I've even seen like cardiologists who just seem ignorant on some of the topics. I've seen endocrinologists who say shockingly uninformed things. And so I thought this might be a good connection to make. And, Jodie, a lot of people might already know your story, but maybe you can just give a brief recap of what happened.
Yeah, I totally can. And then I can even touch on the topic of cardiologists and other doctors not being well versed in whatever could be going on. Well, it started, I competed in NPC Nationals, where I earned my pro card November of 2020. And about 4 to 6 weeks before I ever made it to the show, I started popping fevers, just feeling overall bad. But any bodybuilder knows that when you're in prep, you're not going to feel great at the end of it. It's just kind of it's known. So, I mean, I knew something felt off, but I just kept going because, I mean, I prepped for 11 months due to COVID, canceling show after show. So I got my kind of lead-in protocol for my diuretic use leading into the show. And it honestly, it worried me. It did. And I mean, I'm an extreme person, but I was nervous looking at it. But I did it because I'm a client that follows the plan. I don't detour from plan. That diuretic protocol, it was ramping up over the course of 10 days, starting with aldactone, 25 milligrams AM PM. The following day, it was like another 25 AM PM, and then it ramped up to 50 AM PM, and then it got as high as 100 milligrams of aldactone AM and PM. But then Nationals was a 2-day show, and I got to Orlando Tuesday or Wednesday. And the night before prejudging, so Thursday, the day before prejudging on Thursday, I led into the show drinking 3 gallons of water. I mean, still don't feel great, but you're a day out from a show. And my water was cut at like 2:30 or 3 p.m. completely. Said drink no more water unless instructed. I was checking in, God, after every meal, and it was like, oh no, this is working perfectly. And then that night, on top of the aldactone, the 100 AM, 100 PM, then we also threw on diazide. So I ended up taking 1 or 2 diazide. I can't remember exactly. I don't have my protocol right here in front of me. I'm in my car at work, but so I took that, didn't sleep a wink. I was internally on fire, but like I couldn't sweat. I mean, in the moment, it seemed like a blessing because I didn't want to ruin my tan, right? But I was so hot and just, I mean, it felt like my skin was burning from the inside out. It was miserable. So the next morning, I get up and I'm cramping so bad. I'd started cramping in the middle of the night. Low back pain, feet cramps. I was even cramping the day before, and was told to go get taurine and take 2,000 milligrams every 2 hours. So the cramps were so awful, and I was voicing all of this to my coach, and he's like, just keep taking taurine, like send me check-in pics now and then at this time. And so we go and do the show, and ended up center, and it was great. I mean, of course, in those moments, you're just thrilled because you know what's happening. But my finals weren't. That was on Friday. I got off stage about 10:40 a.m. And my coach was like, okay, drink 8 ounces of water. And little did I know, like, how small of an amount 8 ounces is. It was like, take a shot of water, basically. So I did, and I didn't feel any better, but just momentary satisfaction. And my finals didn't start until the following day. at like 7:40 p.m. Cut water after prejudging at 10:38 on a Friday. I didn't drink water again until 8:30, 8:45 on Saturday. In between those times, I obviously was eating, checking in, telling him I'm cramping. I don't feel like great, but I just thought that's what it took to go pro. And it's not, but obviously earned my pro card, and I'm trying to remember the dates, but it was 2 to 3 weeks after I'd made it home back to Louisville, and I'd continued popping fevers, and I kept getting quarantined from work because of COVID. They're like, oh, COVID test, COVID test. I never came back with COVID. Well, the low back pain started. I mean, to the point, like at first, like day one, I was like, oh, this is weird. But I was training and everything else. But the low back pain got so horrible. I couldn't stand, I couldn't lay, I couldn't sit. I mean, it hurt to breathe. So I'm not one of those people that wants to alarm like my family, or I don't freak people out. So I just asked my parents if they could keep my kiddo for an evening. I was going to go to an immediate care center and get checked out. Well, I went to an emergency room, and as soon as I walked in, they didn't even have me fill out paperwork. They just put me in a wheelchair and took me back. And they told me it's because of the jaundice colors under my eyes, and I looked horrible. So they did all sorts of lab work, and I came back with rhabdo. So my creatinine levels were sky high, EGFR, all of those numbers. I don't have those labs pulled up right in front of me. It was almost coming up on a year ago now. But that's what kind of started all of it. So I was then off work for, 5 or 6 weeks. I think it was 5 weeks. They kept me in the hospital for like 2 or 3 days. And then I was off work, just resting, absolutely miserable. And then after, like once I kind of started feeling like I was on the mend and going back to work, I had a shoulder surgery because I had a shoulder injury go on for damn near a year. I prepped on it and tore my rotator cuff, my labrum, my bicep tendon. I had to get all that fixed. So I did. And then shortly after that, like once I was able to kind of start training again, then I got to noticing like just random chest pains I would have and heart palpitations, and like to the point in the gym where even if it was my first set of like just getting there to train, I would have to sit down for, 5-10 minutes just because my heart was beating so fast and so hard over nothing. But then that's when I started noticing that my heart rate was constantly beating. Faster than normal, but just minimal activity, my heart was racing, and then I would feel palpitations. And if it was like one here and there, I was okay, but then it started happening consistently. And sorry, long story short, I got checked out. They couldn't really see anything. They said that my first set of chest x-rays were very, very blurry. They said something about my lungs were overly vascular. You couldn't see much, and they sent me home. So it's cool. They kept me for like 7 hours and then sent me home. I made it 2.5 days at work and then collapsed in my parents' driveway after work. I went to get out of my truck and my legs didn't catch me. Chest pain. I couldn't sweat. Like I couldn't breathe. And I ended up admitted at the same hospital that sent me home 2.5 days prior. And my first set of chest x-rays showed that the same stuff in my lungs that they then kind of deemed to be pulmonary edema. And it looked like it could have been bilateral pneumonia. It wasn't that. It was just I was full of edema. And in those 2.5 days, I had shot up 21 pounds in fluid. And edema had been happening, but nothing to the extent of that. So that brings us up to late August of this year. So I'm still kind of going through this. So I stayed in the hospital 5 or 6 days. And then from there, they sent me to my primary care provider, who then was sending me to cardiologist, pulmonologist, and nephrologist. Because through all of this, my creatinine levels, on top of, they had me on a cardiac unit, but my creatinine levels in every single lab they did, I mean, my veins wouldn't give blood by the end of this. My creatinine level swings were like anywhere between like 0.5 points up to 4 and 5 points within hours. So, and that's what my RN said. She was like, well, these look like two different people's labs from lab to lab. So I kind of brought up something to cardiology, or he says he was a cardiologist. He was the doctor I dealt with in the hospital, about autoimmune issues, because autoimmune runs in my family. And whenever you take steroids for a prolonged amount of time, like, your immune system's lower. My immune system was already low. I'm like, it's something to explore. I just want answers. And he said, it couldn't be that. Well, he ran a C-reactive protein and like one other test. The two tests he said would not come back were literally quadruple the numbers they were supposed to be. But he still would not say what it was. He's
Do you
like,
remember
no,
what the
I just don't.
CRP was by chance?
The CRP, I'm trying to remember which one is supposed to be between 1 and 20 or something like that. Is that the CRP?
Yeah.
Because I remember seeing, my first one came back at 65.
Wow.
But what was what was do you remember the BUN and creatinine numbers, like, or where you are today with that?
So I just had lab work. I'm trying to remember. Whenever I went in, like my first set of labs, they were literally doing labs on me. Like, I mean, it felt like every few hours. When I first went in, my creatinine was like, I think 2.3, which that's not bad in my book. I mean, it's high, but for me, I was like, heck yeah, it's down. And then it got all the way up as high as 8. So it was literally just doing this. And my BUN, I can't remember. I've got all the labs in my
probably over
my app,
100,
but
80, probably 80 or 100. It seemed, boy, Jodie, my heart goes out to you. I mean, it seems like you had, you had acute renal, it's called acute renal failure, right? Rhabdomyolysis and acute renal failure go hand in hand, right?
yeah.
The muscle, because of dehydration and we could talk about those drugs, but we'll wrap it up in the end though. But my heart goes out to you. It's just a very painful story.
It's just I mean, I never experienced anything like this. I mean, I've had injuries. Everybody gets injured, but I mean, it hit me like a train. Like, I went from the most insane shape of my life, and I mean, I didn't feel great, but to now, I mean, going upstairs, I'm like, well, I don't know what this body is up to. I literally live in a body now that I don't know what it's doing day to day.
So if you don't mind, Dr. Dave, we can go, start to go
Take the
over.
lead.
Yeah, if you don't mind me asking some questions, Jodie. So, I mean,
No
first
bet.
off, yeah, I mean, it's just, I've worked with bodybuilders in the beginning of this career of mine 15 years ago, and most of them kind of went away because they know that I don't give a blessing on it. And my average guy is just a regular guy who just likes to do some steroids and bench press in the basement,
Yeah.
and power lifters, power lifters. I'm not going to say that power lifters and strong men are any, they're not angels, and they use steroids too, but they don't dehydrate like this. They would never do that because they don't care, how their ass is looking. They just want to bench big weight, squat a lot, and deadlift a lot. So it's believe it or not, it's actually healthier. I mean, because
No,
they're not doing
100% it is.
so but that, and I've been very aggressive towards, competitive bodybuilders because of the narcissism and this extreme deadly stuff that these coaches are going to have to start getting liability. Arnold's talking about liability. The feds are involved, and just trust me, they are. So, and I don't want that per se. I just, because I'm staying out of the politics, but I mean, let's talk about the drugs: spironolactone, aldactone, potassium sparing diuretic, diazide, combination of two medications, okay? Triamptorine and hydrochlorothiazide, that's a thiazide diuretic. That's two very powerful, three powerful diuretics. The doses are so high, we don't even give this to, these are for people that have hypertension, the thiazide, and congestive heart failure, but there's stable congestive heart failure, either elderly women, men, and we use baby doses to maintain their fluid status, so they don't get overloaded. And
when I was in the hospital, they diuresed me.
Correct.
With lower doses than I ever took.
Yeah. So it's ironic that the drugs that end up destroying the heart and kidney are medicines we have to use carefully in the post period. But I'm an internal medicine doctor. I used to work in hospitals for people that have congestive heart failure. So you presented on the second presentation after the rhabdo, weeks later, with the chest pain and shortness of breath. You presented into the cardiac clinic with classic congestive heart failure. That was the bilateral pulmonary edema. That's what we see. And, I listened to your story. My wife actually is my nurse, and she worked for 11 years in the cardiac unit. So we're living, eating, sleeping, and shitting cardiovascular medicine. And I'm an internal medicine doctor. These guys are giving you drugs that, and the no drinking and all this. I mean, this is just the most unbelievable. So my heart goes out to you. And again, I'm criticizing the gurus and threatening them. There's a threat right to them, because I just can't believe it. Either, in this world, they're not doctors, so they can't get sued. If it was me doing it, I would be sued, blued, and tattooed. Yep. So, but they're not doctors, and they skirt that, and they're wise guys, and they act like they're little doctors, and they put down doctors. They put down doctors because they don't. How the fuck can a doctor know? What doctor is going to do this with any intelligence of understanding? Oh, this stuff works. So they make these bodies up there. They make those bodies, and it's just so. Let me ask you a question right now. Like today, where you are right now, how old are you? First off, if you don't mind asking, how old?
I'm 30.
So super young, 30-year-old woman. What do you have a diagnosis of legitimate heart failure, myocarditis?
No.
Your heart's good. Your heart's okay.
I wouldn't go that far. So they the cardiologist when I left the hospital. Then I asked to see a different cardiologist, because the doctor in the hospital, I'm very transparent about testosterone use and things that I've used. And you have to be, because I was taught, if you take it, tell your doctor, because you need to be treated differently than if you don't. So I just told him. And from that moment on, he insisted on giving me tox screens. He thought I was just a drug addict. And obviously my tox screens came back negative for nothing. And he told me that my entire issue was the testosterone. He couldn't even pronounce enanthate. He had to Google it. So I asked for a different cardiologist. Yeah.
It's sad.
And I met the new cardiologist, and he wanted me to be on a heart monitor for like 2 weeks. And I did that, and I sent it back. And then he wanted my, blood pressure medicine and my beta blocker switched around. He wanted to try me on other stuff, because what the heart monitor picked up is what they picked up in the hospital, was that I do have the palpitations and mitral valve regurgitation stuff going on. And because they saw it on an EKG, and he said his big thing he wanted to check out was to see if there was a specific time it was happening, which would then indicate blockage, or if it was, he called it an electrical issue. And it's just,
what's your ejection fraction? Do you know what your ejection fraction is?
I remember Dr. Dave asking me that, and I looked it up, and it was 35.
Yeah, that's low. Yeah. So that's today. So your ejection fraction. So you have heart failure right now. That's you're living with a low ejection fraction. 35.
I mean, yeah. So I'm trying to think. My last cardiology appointment was
And
3-4 weeks.
And you're on beta blockers and different medicines for the heart failure, for the heart condition, and hopefully it gets better. Let me ask, so do you also, at the same time, you also have kidney disease? Is that true? Okay, and so you have, do they call it, do they say it's focal segmental glomerular? Have you had a kidney biopsy?
FSGS, that's what the nephrologist thinks that it is. So we're going through that, and then we actually just started some more autoimmune testing stuff too, because FSGS is what I brought up to the internal medicine doctor in the hospital. That's what he said it absolutely could not be.
Well, yeah.
So, yeah.
I mean, you got to understand, I mean, I'm only guessing in this stuff, and I'm just throwing down the dice because steroids on top of genetics. So it's like, why isn't it that every steroid user ends up with heart failure and kidney disease? And the answer is very clear. There's permutations and combinations of genetics, autoimmune, genetics, again, genetics are everything. And then the threshold, there's a threshold. You had a lower threat. First of all, the drugs, I can't believe people tolerate those, but they do. Most of the girls, most of the guys and girls we know, they tolerate 25 twice a day of spironolactone, aldactone, and then you throw in the diazide, the 100 up to 24 hours before, 200 milligrams a day, and then no water. Hey guys, no water. And then they do crazy other stuff. Again, I'm a power lifter, so I hear it. I don't really see this stuff anymore. I see it, but these guys stay away from me because they know I'm just so, I mean, patients come to me and I've seen it a million times, unfortunately, but most people walk away from it in the beginning because there's so much reserve. You're so young and healthy, but obviously you cross the line and you have a threshold. So with the grace of God, it's amazing. You're so young. It's amazing that the body can come back and heal. The kidney again, I'm going to be careful. The kidney, if you're creatinine, if you have FSGS and you have a creatinine, if you're a small woman, if you're creatinine, versus a man that has a lot of muscle tissue, it's a different, the creatinines are different. I mean, it's a different number. So, and it's an estimated GFR, right? It's an estimation. And these guys have to do, there's a way to determine your true or more accurate glomerular filtration rate by doing you've done 24-hour urine analysis. I know they've done all that, and they've done biopsies. So if your creatinine is sitting there 1.5 or 2 point something, that's for you, that's going to be chronic kidney disease. The kidneys will stabilize, and my guess is you're there. You're making urine, your potassium levels are normal. This is the deadly stuff. I mean, that's the video I did that, I'm trying to be quiet for now, but it's well known that the guy died from inside information with the same stuff you did. And the potassium goes up high and it leads to cardiac arrest. But
I was told I shouldn't have made it to the stage.
Well, but so many people do. I mean, so why did it happen to you? With the grace of God, there's no one's going to answer that. You hit your over under. Now you're young, thank God, and you're stopped. The heart could possibly come back. I'm just telling you, I want to tell you some good news.
Yeah.
The heart, I've seen the ejection fractions of low normal, 35, 40, around here, over just a period of just because the heart's stunned and it could come back, but you got to work with great let me tell you a name. Dr. Andrew Bombach is my go-to guy. I want everyone to hear that. He's a board certified nephrologist. I call him the anabolic nephrologist. He's a cool dude. He's not going to
Yeah.
be a hateful, hater. He's not going to be a disrespectful doctor. He knows I've sent him steroid users for over 10 years. He's Columbia University, so he's not a schlep, right? He's a smart guy. Columbia
Yeah.
in New York City.
Yeah.
He knows the protocols. He knows FSGS. There's other doctors in the country, but they have to understand the steroid and the drugs that have been used because it leads to FSGS
Yeah.
almost exclusively. So
I've used quite a few of them.
yeah, so
Why, yeah.
that's it.
Jodie, can I
I'm
ask?
transparent. Yeah.
Your resting heart rate at one point was in the 130s. Where is it
It was
sitting around today?
138.
Yeah.
Today, the lowest I've gotten it was I actually was when I was at my last pulmonary appointment, and it was, I think, 116.
So
Even
right
on the
now,
So it's
beta
improved.
blockers.
your medicine right
Yeah.
now, your heart rate's over 100 beats per minute on medicine.
Every day.
Yeah, they got to work on that. You got to work on. Yeah, you got to go back to your doctor and work on that. It's a tough deal. I just don't. I got to be careful because I don't know really what's.
Yeah.
It's kind of
No,
patchy.
I know.
It's
I
a little
know. I mean,
patchy.
I just see it as an improvement. And one thing I will say, so when I say I'm going back to the gym, obviously I'm not doing anything near what I was doing, but just simply walking on a treadmill, doing anything. Now I have to take a lot of breaks because my heart rate gets up there really, really fast. But I've noticed over the course of the last week and a half, just me taking my time and walking where I need to walk. Like I can feel where normally I just feel my heart rate way up here. I can feel it drop where before I could never feel a drop. So I'm trying. I mean, I just feel like I'm sitting around like waiting on, pardon my language, but waiting on fucking answers, and I can't really get anything. And like, I'm just like, well, I'm just gonna keep going to work and until I have an issue, and then I'm off for a little bit, and then I come back to work, and I'm just like, I just want to get
Where
it
are you
figured out.
located? I just want to make
I'm in Louisville, Kentucky.
Okay, so let me I want to because obviously you're not a patient, but when I've worked with people like you, I'm an internal medicine doctor, so I'm kind of like a jack of all. I'm an
Yeah.
ex-GP, but I know what's going on. You have to go to a center of excellence. I'm not putting your doctor down. You need
Yeah.
specialized care. You should go to University of Kentucky. You should go to the
Okay.
academic medical center. They're going to love to take you because they have residents like when I was teaching in the med school, in the residency training program. So you want to go there to the chief. If you have insurance or not, it's not going to really matter.
Yeah, I do.
Yeah, so it doesn't really matter. If you go to an academic medical center, University of Kentucky, one of the top, whichever, Louisville, or that's a great place.
Kentucky would be better.
Yeah,
Yeah,
but
University of Kentucky would be better.
Yeah, whatever one you think is great, and then you just look at the Department of Cardiology, and you just hammer in there and talk to the chief. The chief the chief. There's always a chief. There's always leaders in there, and you want to go to see them because your doctor. Again, I'm not putting your doctor down. I'm very Doctors are busy, guys. They're fucking busy. You're busy. David's busy because he's a doctor. Come on, everyone's busy. It's super specialized. You're very young. They may look at you and you're beyond the discrimination and not knowing the steroids. They look at your vital signs and they may not fully understand the whole picture of this is cardio. It looks like cardiorenal syndrome, which I've done articles for 15 years on. The heart and the kidney are together. They're little babies. They're very fragile. And then the heart rate, the fluid, the fluid, the electrolytes. You see, this is all cardiorenal. It's the heart and the kidney. So that's why you need to get two specialists, and they're gonna want you to have a general doctor in between. And I know it's difficult because there's no accessibility. It's hard so you're learning it yourself. But the heart and the kidney, you need the best nephrology doctor at the university. And you could talk to Dr. Bombach. You could reach out to him because he's I send him every month one new patient that has kidney
Yeah,
disease.
I'll reach out to him.
Yeah,
I'll definitely reach out to him.
so he knows he knows the protocols. He's aware of how the disease happens from the pathophysiologic standpoint. But
Yeah.
he's still going to look at it, and hopefully you're not going to be on dialysis or get a kidney transplant in the near future.
That's what I want to avoid. I have a friend of mine who's been on dialysis for about a year now. FSGS yep. And so I've been talking to them and just kind of going through it, and they just keep telling me, like, listen, stay off of this as long as you can. Like, they finally are doing in-home dialysis, which is a lot better, but
yeah, no, I parents, and I know I'm working a gentleman right now. That's the video I did about the 40-year-old guy he's on dialysis finally. He's making some urine, but he's not stable, and he's getting a transplant, but they have to go through hemodialysis right now. He's freaked out. He's only 40 something, and again, he was living his whole life feeling like $1 million, and his kidneys are going to be toasted. It's over. So you need, but you're going to be on. You need some medicines to protect. ACE inhibitors, ARBs. I assume you're on no diuretics right now. I assume, right? None.
No.
Yeah. So the hospital scenario, acute hospital scenario versus the outpatient is so different. You need a doctor that understands both of these venues and understands the FSGS, understands the pathophysiology like I do, and to understand the healing, which is time, but you need special medicines. Like, are you on an ACE inhibitor or an ARB right now? Do you know what that is?
So what I'm on right now is going to be my blood pressure medicine, my
which is what? Which is name?
lisinopril.
Oh yeah, that's an ACE inhibitor. Yeah.
Yeah.
That's what I was going to ask about, Jodie.
So they're also keeping me on prednisone too.
Yeah, they're trying to slow the whole thing down, but that's a tough deal. But I don't touch into the prednisone. Do you have protein in the urine? Do you have protein in the urine?
The last time they did a urinalysis on me, they said that there were proteins in my urine.
Yeah, so you have FSGS, yeah. So you got to go to an expert like Bombach. Again, your doctors, I'm being very careful. These are doctors.
Oh, yeah, no, I understand. That's why I'm not name dropping them. Yep.
Yeah, no. But this is a tough world. This is very specialized. That's why I'm the anabolic doc, and I love what I do, and I'm always humble for it. But I'm aggressive to these assholes, to these evil villains that are doing this to people. And I've always been aggressive. And for the haters are going to hate. But look at this shit. Look at this shit. I mean, again, don't worry, guys. I'm armed. I mean, like, I'm going to give you for all the clowns and all the drama you want to hear. This is bullshit. But I'm done. I'm a healer, and that is what it is. But you're suffering, and you may not come back, and you may have chronic kidney disease probably the rest of your life and need a transplant sooner or later. Your doctors have to slow down the train, slow the train down, and your heart is the same thing. And getting a heart transplant, woo! I've seen it all. I mean, for heart failure, the heart's going to be different. I think the kidneys are going to be chronic. That's going to be, you need to slow the train down. But the heart, with the grace of God, hopefully may bounce back, because I've seen it. I've seen patients just like you, but more men. I've done some consults for women. I really didn't feel comfortable taking care of women because I give testosterone to everyone who needs it. And I know women, could use it. Not, I'm not a spring chicken, and I know I'm not a prima donna. I know what's going on, and I would never discriminate on anyone, and especially you. But this is our world, right? So I did it to myself. I'm on testosterone 30 years because I shut myself down in my 20s. And I love to be, I love it. I mean, I love it. There's no, but you got to understand the physiology, guys. This is not for you, Jodie. Hopefully your doctors, you need the best experts in the world, really, to understand the heart and the kidney. And I think they could really slow it down. So Oh boy, Jody.
The only thing I would
What message?
ask Jody, and you can always get back to me on this later, but I'm surprised that the resting heart rate is so high, given you're on an ACE inhibitor, given you're on beta blocker. And I don't know what you were like. Maybe the 35% is improved. Maybe you were 25% before. I only know this one value, but that is shockingly high for a resting heart rate. And for people who don't know, both of those drugs, beta blockers more so, but both of those drugs can contribute to remodeling, like, in a positive direction for the heart. And that's what, Dr. O'Connor's talking about, how the heart is, it's not as resilient as like the liver, but sometimes you will see somebody with like a 35% ejection fraction get back up to, 40, 45, even back to a normal ejection fraction. So obviously your cardiologist is going to play around with that.
You need a heart. You're right. So let me talk about, you need ACE inhibitors. You're going to need some beta blockers, and there's remodeling and the ejection fractions and the endothelial issues. I'm an internal medicine doctor, obviously. I mean, your heart rate, you need a heart failure specialist. They're just cardiology doctors.
Yeah.
This is more important, I think, than anything else for you, instead of discussing the discrete physiology. But I know, Doc, I know that it's important. People love it. Guys love it, but it's going to go over people's, maybe it's not going to go over their heads, but they try to be little doctors, and it's just pissing me off. I'm sorry. Yeah. So you need a heart failure, not just a cardiologist, because your heart rate can't be like this. The doc is right here. Heart rate needs to be down into the 70s, 60s, 70s.
Before all of this, my resting heart rate stayed in the low 60s.
But that's normal. Normal. Yeah. So, but you see the heart, but the beta blockers should be working. They should be, but you can't be hypotensive. If your if you're on all these medicines, forget all the beta blockers and calcium channel blockers and ACE and ARB, and we can go on till we're blue in the face. I'm an internist, okay? But this is not, you need a heart failure specialist. At this point, but we're not going to, I mean, your heart rate should be modified and should be modulated to a point. But if your blood pressure is 90 over 60 and you're getting out of your truck and you're like dizzy, you stand up and you're dizzy, that's a problem. So that's why, Dr. Dave, that's why she needs a heart failure specialist, not not just a run-of-the-mill cardiology doctor. That's why University of Kentucky, Louisville, or whatever you're going to go, you need a cardiology doctor who's a heart failure doctor. You have to understand there's subdivisions. There's 7 types of cardiology doctors in the world now.
Oh, wow. I didn't know that.
Oh, yeah. There's, the general cardiology doctor, it may not be able to do it. You probably have general cardiology. And again, I'm not putting, they don't know, they don't know that your heart rate is up so high. They probably don't know it. You got to take care of yourself. You got to go to the heart failure. I'm just trying to hammer it over and over. You got to go to a cardiology doctor, and call them, who is a specialist with not just cardiology, heart failure, one, and then nephrology doctor. Just any academic nephrology doctor is going to be able, and you're going to put those two together, and they're going to change your regimen. They're going to tweak you.
And you said it was Dr. Bombach, is that right?
Andrew Bombach in Columbia University. Andrew Bombach, Dr. Columbia. He's somewhere in New York City. I don't know, Brooklyn. He's Bronx.
I'll travel.
He's a great dude. He's a great guy. He may do consultations, telemedicine. I can't. He's booked out. He's a great guy, though. He's just a nice person. He's not gonna. You're not gonna shock him. Like the other doctors are like, whoa. And that's not good when whoa. They're gonna, when they're looking like a deer in the headlight.
Yeah, it's not good when a doctor has to Google the side effects of testosterone and he can't say enanthate and doesn't know what the side effects are.
You can't have a deer in the headlight, but you're going to get a deer in the headlight. But if you go to some of the, academic medical centers, they at least will know what to do, the top medical regimen for your, again, like your heart rate, your blood pressure, the remodeling. They want to foster the remodeling. It is true.
Yeah.
Dave's right. He is right, but Dave, it's complicated, buddy. I don't even do it because I'm not a cardiologist, and I'm telling you, it's so complicated. And there's new medicines. Jody, don't hate on the medicines. You go to there's you need some of these brand new modern medicines. I'm not going to mention.
I will never hate on a medication. I'll try anything they'll give me, and that's basically where I'm at with it.
Modern medicine, if done properly, Jody, modern medicine is there's a reason why it's called modern medicine. But if there's some modern medicines for the heart with your ejection fraction and the way you have, and depending on if you have autoimmune conditions and whatever, there's so many other things they have to do a detailed history. This is what the stuff I bring it together, and then I work with the doc, and I kind of tell the doc, I keep reminding the doc, hey doc, and then we maybe shift over. I'm like a traffic cop, I like direct traffic. So I mean, because I'm being very careful not to say physiologic stuff. I'm the top doc in the world for steroid, obviously, stuff, and you see me keeping my mouth shut except for my political threats. I say that because Dave needs some views on this.
Right.
All right. I'm sorry, Jody. There's no joke, though. My heart goes out to you, Jody. I'm sorry.
I appreciate you. I'm going to look up Dr. Bombach and even if it's telemedicine, I don't mind to wait. I'm also going to look into the University of Kentucky just because the experience I had in this last hospital was with the University of Louisville doctors. So I'm just going to steer clear. I only use the University of Louisville for my sports medicine injuries. That's where they're good. So I'll go to UK.
Select. You got to, it's all about the team, right? And you got, when you find the best team in the world, it's not the first person you interview.
No. Oh God, no.
So you're going to do it. You're going to do it. And heart failure. It's
a process.
Heart failure, Jody. Cardiology, department cardiology, heart failure expert.
Heart failure. Yes, got it. I appreciate you all taking the time today. Like it's been like a little while in the making, but I am super grateful for you having me on, and thank you.
Yeah, thank you for sharing your story again, Jody. I know this is emotionally, a lot for you, and thank you, Dr. O'Connor, for coming on and hearing the story, giving your input. And I know, Doc, you have your YouTube channel, you got your Instagram, you got your app. I'll put context, all that. Jody, if you want, I know you still have a lot of your stuff on your Instagram, and I can put that up as well.
Yeah, you can post that. That's fine.
Awesome. Any closing remarks or?
Only closing remarks for me are to any bodybuilders watching this with the same attitude that I had, that, oh, none of this shit's going to happen. You're not invincible, especially with how much shit I see people doing. And I'm one to talk. I did it too, but treat your bodies with some respect. You only get one of them. And when it doesn't work the way you want it to, or potentially might not ever work the way you want it to again, it's a come to Jesus that you really don't want to have.
Yeah.
So just take my advice, treat your bodies with respect, love yourself.
Yeah. All right.
So that's it for me.
All right. Well, thank you again, guys.
Thanks, guys. Thank you so much, Don.
Thank you.
Thank you.